name is Dr. Doug Slane. I'm an infectious disease clinical specialist and professor of pharmacy and medicine at West Virginia University. I received my pharmacy or Doctor of Pharmacy degree from Duquesne University in Pittsburgh, Pennsylvania. After that, I completed residency and fellowship training in infectious diseases at the Medical College of Virginia Hospitals, which is now referred to as VCU Health. I chose pharmacy because I wanted to do something positive. I was interested in healthcare, and I was fascinated with the way that medications worked. I also knew some pharmacists in our neighborhood, and my parents knew some pharmacists who I got to meet and found them to be really well respected, very knowledgeable, and quite successful in their careers. So it was easy for me to look into pharmacy, and then I shadowed many different pharmacists in many different settings before I settled on applying to pharmacy school. What I do in my daily practice now, a typical day would be in the morning, I would participate in care rounds at the hospital. So I would be on the infectious disease consult team. So I'm on that team with an infectious disease physician, myself as an infectious disease pharmacist. We have residents with us. We have students in pharmacy and medicine with us. And we also have a nurse practitioner. And we round in the hospital in the morning. We take care of patients who are infected and have complex conditions that we try to solve. After rounds, we typically will have noon conferences or other meetings where we talk about things related to education or patient care or various other things related to pharmacy or healthcare. In the afternoon, I may dedicate some of my time to leading a small group discussion for residents and students on a topic, may participate in other meetings for national societies or some local meetings. I also will look at microbiology reports and some lab values for some of our patients and look at our medication lists for the patients on my service to make sure that everything looks good before I leave for the day. And that's kind of a typical daily routine for me. What I like about pharmacy is that it's just a great profession because there's so many avenues that you can go with this degree, even though many people aren't aware of it. I also like in my current position, I get to work with some very intelligent people, and we really get to learn while we're working, really get to see a lot of neat, interesting things and solve a lot of problems. And a lot of our patients really appreciate what we do for them, as do the individuals that we train. My advice for anyone that is considering a healthcare career or pharmacy in particular is to really look around at the different places pharmacists work. Try and shadow as many people as you can. Find out about all the different places that pharmacists practice. Most of us are familiar at a young age with the corner drugstore, and honestly, there are so many different and rewarding jobs out there in pharmacy in all different settings. So you really need to look around. I've been particularly thrilled. I've been a pharmacist for about 30 years, and I have no regrets, and it's provided me with a great career. So hopefully you'll find this interesting and helpful. Best of luck.